Hello. Okay. So first of all, hello to everybody and to the Secretariat as well. As Secretary of State, I'm Joe, and I'm a neuropsychologist, and I'm fascinated by brains. Every one of us has a different neuro shape. Our brains are sculpted by how our bodies and our senses interact with the world. And it's the diversity of those brains, not the similarity, that drives human progress, innovation, and growth. But what happens when certain brains are excluded? Progress stalls. Innovation dries up. Growth slows. Now 20% of our population are disabled, and that is a lot of brains, a lot of potential, and a lot of those brains are currently locked out. Society is making an expensive mistake. We're still stuck in a narrative where disabled people are seen as burdens, not innovators, not contributors, and that's wrong. There needs to be a change of mindset in this country. We, deaf and disabled people, are a resource. With the right support, our skills, our insight, our innovation will benefit everyone. This isn't about charity, it's about strategy. Removing barriers is an investment, it's a growth plan for economic growth, cultural growth, scientific discoveries, and innovation. But here's the problem. That idea is completely missing from the current political conversation. We're not hearing about deaf and disabled people as economic drivers. We're still hearing about us as problems to be managed. Imagine if that narrative was to change. Imagine that if every deaf child grew up knowing that they were seen and valued as a contributor of ideas, of value and innovation. So let me tell you a story. Picture a Monet painting, you know the one, water lilies, soft light, a bit blurry. Now what you may not know is that at the time, Monet was going blind. And so that impressionistic style, which changed the world of art, came from his disability. So his vision was the world's game. So now, let me ask you, is the world gaining from our deaf game? I think the answer at the moment is not yet. I just need to thank you. So, you're not yet benefiting from our unique visual minds, our spatial language, our global deaf community, and our hunger to communicate. I don't think yet that you are benefiting from us. So let me give you an example. Now my husband is deaf, and he works as a software engineer. He thinks in BSL, which is a spatial language, and that lets him approach coding completely differently from his hearing peers. His hearing colleagues think in lines. He thinks 3D. That's innovation, that's deaf game. But society is missing out on that. Doesn't even realise that there's something there to be missed out on. And we've seen the recognition of the contributions of women, LGBTQ+ people, people of colour. Maybe now it's time for deaf and disabled people to be recognised, not just as equal, but actually as essential to society and our economy. Because right now, we are struggling. We experience language deprivation, poorer health, poorer mental health, poorer literacy. We have less access to education, to jobs and services. We're left out of the NHS and social care. We avoid going to the GP and A&E because we know interpreters won't be provided. Certainly not regularly. And sometimes our children have to interpret a cancer diagnosis or interpret conversations about domestic abuse. That's not just unfair, it's trauma. More than half of us can't understand a diagnosis when we're given one. We don't understand our treatment or our medication. We can't access mental health services, crisis lines, or preventative care. And we can't just pick up the phone to access those services because there is no universal BSL video service. We have long hospital stays because there are only 2 care homes in the whole of the UK for older people that use BSL. Now, the new local focus on neighbourhood services will not meet the needs of our dispersed BSL population because our needs will just be lost in the localities. There simply aren't enough of us to make providing local services make sense. So the expertise in provision for deaf people becomes diluted and ineffective. Just providing BSL interpreters is not always the answer. And the costs of exclusion are genuinely enormous for us and for society. The NHS currently loses up to £100 million a year due to missed appointments when interpreters aren't provided. With escalating care needs and long-term costs that could otherwise be unavoided. And to give just one example of that, one deaf woman had to sleep in an A&E cubicle for 6 months before a suitable care placement could be found.
Carry on. I've got 8 minutes to get there, so we're alright.
So one deaf woman ended up sleeping in an A&E cubicle for 6 months because a suitable care placement couldn't be found for her to be transitioned from. And that's what happens when access is not afforded. Now, like Molly, I'm also going blind, and this winter, as I struggled with the light and the low winter sun, my struggle became your gain. Because I wrote a report to the BSL Act Advisory Board on deaf and deafblind users' access to health and social care. It's based on findings from 60 expert organisations, networks and experts, and it will offer 12 clear recommendations to stop this cycle of exclusion. We're going to be launching it in the House of Parliament in September, and I would like to warmly invite you to hear the rest of this story, and also the Minister for Social Security and Disability. So we would like to invite both of you to hear the rest of this story, to hear our vision, because this is more than about fairness. It's about unleashing innovation, unlocking economic growth, and it's about changing the story. So deaf and disabled people are no longer seen